Today we will talk about this brain. Brain injury have emerged as a critical concern in the professional sports. As athletes push the boundary of human performance, the risk of sustaining injury, particularly to the brain, has become a pressing issue. In this video, we will deep dive into the various dimensions of brain injury among professional athletes, examine their types, cause, prevalence, effect, and improvements made in management and the prevention. We'll also look into some famous case study. Let's first know about the types of brain injury in professional sports. So professional athletes are susceptible to several types of brain injury, each with distinct characteristics and implications. So concussions is one of them. So concussions are the most common type of brain injury in the sport. They occur when the blow to the head causes the brain to move rapidly within the skull, leading to temporary disruption in the brain function. Symptoms include headache, confusion, dizziness, and memory problem. While often considered minor, repeated concussions can have a severe long-term effect. Next is the chronic traumatic encephalopathy, CTE. CTE is a progressive degenerative disease found in individuals with a history of repetitive brain trauma. It is particularly prevalent among the athletes in contact sport. So symptoms which may appear years after the injury, including memory loss, confusion, impaired judgment, aggression, depression, and eventually dementia. And another one is traumatic brain injury, TBI. TBI encompasses a broad range of brain injury from mild to severe. In sports, TBIs can result from the direct impact or violent movements causing the brain to collide with the skull. Severe TBIs can lead to prolonged unconsciousness or memory loss and may result in significant cognitive and physical impairments. Now we will talk about the causes of brain injury in professional athletes. Brain injury in professional sports arise from the various activities, each contributing uniquely to the risk profile of the athlete involved. First, we will start with contact sport. Football, rugby, and hockey are notorious for the high rates of brain injury. The intense physical contact and the frequently collision inherent in this sport significantly increase the risk of concussions and other brain injury. Next is high velocity sports. Athletes participating in the sport like cycling, skiing, and the motor sports are at risk due to the high speed involved. Crashes and the fall at a high velocity can lead to severe head injury, including concussion and TBIs. Next, combat sport. Boxing, mixed martial arts, MMA, and other combat sport involve directly blows to the head, making brain injury almost inevitable. Repeated punches and kick can lead to both acute injury and long-term condition like CTE. Next, repetitive subconcussive impacts. So not all brain injury result from the concussions. Repetitive subconcussive impact, which are blows that do not cause immediate symptom, can accumulate over time and leading to conditions such as CTE. Now we'll talk about the prevalence and the statistics. Understanding the prevalence of brain injury in professional sport is crucial. So understanding the prevalence of the brain injury in professional sport is crucial for the grasping the magnitude of issues. Incident rate in various sports. So football. So a study has shown that the football players are among the most affected with the high incidence of concussions each season. A study by the Concussions Legacy Foundation revealed that nearly 99% of studied former NFL players showed that the sign of CTE. Next, rugby. So rugby players also face a high risk, with the research indicating that the professional rugby players have a high likelihood of the brain injury compared to the other sports. Next, hockey. So ice hockey player, especially those in the NHL, experiences frequent concussions due to the combination of high speed skating and physical contact. Demographic breakdown. So the brain injury do not discriminate by age or gender, although some patterns are noticeable. Younger athletes and the males are often at high risk due to the nature of their sport and intensity of play. However, female athletes, particularly in soccer and the basketball, also exhibit significant rate of brain injury. Now, comparative analysis with non-athletes. So, professional athletes exhibit a higher incidence of brain injury compared to the general population. The repetitive nature of impact and the physical demand of professional sport contribute to this disparity. Now we'll talk about the symptom and diagnosis of professional sport brain injuries. So recognizing and diagnosing brain injury is a complex yet vital process in managing their effects. So acute symptoms are headache, dizziness, nausea, confusion, loss of consciousness. Long-term or chronic symptoms are memory loss, difficulty concentrating, mood swing, sleep disturbance, depression and anxiety. So diagnosing brain injury involve a combination of clinical evaluation and advanced imaging techniques. So neurophysiology, neuropsychology testing help assess cognitive function, while the MRI and CT scan provide detailed image of brain structure. Now let's look into some famous case study where we will see the real world impact of brain injury on the professional athletes. So understanding the profound impact of brain injury on professional athletes is enhanced by examining specific cases. So this real life story illustrates the severity and long-term consequences of such injuries, highlighting the need for ongoing awareness, research and preventive measurement. So case study 1. A junior Sue was a celebrated linebacker in the National Football League (NFL), playing for the San Diego Chargers, Miami Dolphins and New England Patriots over a 20-year career. Known for his relentless playing style and leadership, Shaw was a 12-time Pro Bowl selection and widely respected within the sport. Throughout his career, Shaw sustained numerous concussions and subconcussive hits. Despite this injury, he often continued to play without adequate recovery time. So post-retirement, Shaw began to exhibit symptoms associated with the chronic traumatic encephalopathy, which is CTE, including mood swing, depression and cognitive difficulties. In 2012, Junior Shaw tragically took his own life at the age of 43. His family donated his brain to the National Institute of Health for the research. The post-mortem examination revealed that Shaw had been suffering from CTE, a neurodegenerative disease, brain disease linked to repeated head trauma. His case drew significant attention to the long-term danger of concussions and the need for a better protective measurement in NFL. Shaw's death was a wake-up call for the NFL and the wide sport community. It led to increased scrutiny of concussion protocol, more rigorous enforcement of the safety measurement, and highlighted the awareness about the risk of CTE. The NFL also implemented initiatives to educate players about the brain health and improve medical support to retired players. Case number 2, Muhammad Ali. So Muhammad Ali, born Cassius Clay, often regarded as the greatest heavyweight boxer of all time. Early career was marked by his exceptional skill, charisma and significant victories, including 3 world heavyweight championships. Boxing inherently involves the repeated blow to the head, and Ali was no exception. His fighting style, which often included taking hits to tire out of opponents, exposed him to significant head trauma. By the end of his career, Ali had fought in 61 professional bouts, many of which were grueling and prolonged. In 1984, 3 years after retiring, Ali was diagnosed with Parkinson's disease, a neurological disorder characterized by tremors, rigidity, and slowed movement. Many experts believe that Ali's Parkinson was intensified by the cumulative brain damage he sustained throughout his boxing career. Early diagnosis and subsequent decline brought widespread attention to the risk associated with boxing and other combat sports. It has sparked debate about the ethics of allowing athletes to endure repeated head trauma, prompt call for reform in the safety regulation. Ali remained a public figure advocating for Parkinson's research and was an inspirational figure in both sport and humanitarian effort until his death in 2016. Case study number 3. Chris Benoit. Chris Benoit was a professional wrestler with the World Wrestling Entertainment (WWE), known for his technical prowess and the intensity in the ring. Benoit had a successful career, winning multiple championships and the accolades. Wrestling, although scripted, involves significant physical risk, including frequent impact to the head. Benoit experienced numerous concussions throughout his career. Over time, he began to show signs of severe neurological and psychological distress, including memory loss, depression, and erratic behavior. In 2007, Benoit tragically took his own life after killing his wife and son. An autopsy revealed that the Benoit had severe CTE compared to an 85-year-old Alzheimer's patient. His brain had suffered intensive damage due to the repeated head trauma. The Benoit case brought to light an extreme risk associated with brain injury in professional wrestling. It led to WWE implementing stricter wellness policy, including concussion management protocol and a ban on chair shot to the head. Benoit's case also contributed to broader discussion about the need to mental health support for athletes. So, brain injury can have profound effect on both cognitive and physical health. Now let's talk about the management and treatment. So, effective management and treatment are crucial for the mitigating the effect of brain injury. So, let's start with immediate response and care. So, prompt medical attention following a brain injury is vital. This includes rest, monitoring symptoms, and gradually returning to physical activity. Next is rehabilitation techniques. So, rehabilitation involves physical therapy, cognitive exercise, and psychological support. So, tailored the rehabilitation program help athletes recover and regain function. So, now we will talk about the long-term management strategy. So, long-term management focus on the monitoring role for the emerging symptom, ongoing therapy, and support for the mental health issues. Lifestyle adjustment such as avoid further head injury are crucial. Now let's talk about the preventive measures. So preventive measures are essential to protect athletes from the brain injury. So rule changes and regulation in sport, which is the first preventive measurement. So many sport organizations have implemented rule changes to reduce the risk of brain injury. For example, the NFL has introduced a stricter concussion protocol and planned penalties for the illegal hits. Next, advances in the protective gear. Technological advancement in the protective gear such as improved helmets aim to minimize the risk of head injury. Continued innovation in this area is vital. So continued innovation in this area is crucial for the safety measurement. So now I would like to conclude here that the brain injury in professional athletes represent a significant health concern with far-reaching implications. While strides have been made in the understanding, diagnosing and managing these injuries, ongoing efforts are necessary to protect athletes and mitigate long-term effects. The future of brain injury management in professional sport hinges on the continued research and innovation, collective commitments to athlete safety. So thank you for watching and see you in the next video.